Today we're going to be covering a very important area of aging, memory, and the brain, and talk about, of course, about Alzheimer's, what you can do about it, and try to give you as much information that's very practical, even as far as helping with prevention of Alzheimer's disease. This slide says Superman in his later years, dang, now where was I going? So as we get older, we do start to get a little forgetful, and that's normal. Forgetting where you put your keys is not Alzheimer's. Forgetting what you do with your keys is Alzheimer's disease. So Alzheimer's disease is not mere forgetfulness. It's really a problem with executive functioning as well. I'm going to say 3 words. Try and remember these 3 words: apple, penny, and table. And I'll screen a little bit. Next slide. And as you know, as the brain ages, you get an atrophy of the brain, you get a decrease in the functioning of the brain cells, the decline in brain repair mechanisms, reduced ability to form new connections, and reduced ability for growth and development of nervous tissue. So as the brain ages, it becomes less plastic. You get accumulation of an abnormal protein called amyloid in the brain, and you get destruction of the neurons. So age-associated memory impairment is not Alzheimer's disease. This is normal aging, and not everybody with aging has age-associated memory impairment, but it's generally thought to be within the normal range, and this is not considered part of Alzheimer's disease. And this is just the normal forgetfulness of aging, and it's usually about 2 standard deviations in memory from what a 25-year-old would be. That's kind of the operational definition of age-associated memory impairment. So then we have a condition called prodromal Alzheimer's disease, or MCI, mild cognitive impairment. That's not the phone company MCI, but it's mild cognitive impairment. And this is a form of Alzheimer's disease where patients start to become very forgetful, and they have really great difficulty in recollecting things, but yet they're still able to function. The lawyer still is working as a lawyer, the doctor, the bookkeeper. They can still perform on a day-to-day level very well, and that's called mild cognitive impairment. There's no significant functional deficits, but we do have biomarkers. So you do have alterations in the brain associated with this disorder. And there are 2 ways we can measure these. One is in spinal fluid, by measuring the amount of CSF, tau, and amyloid in the brain. And the other is through a PET scan. So we now have specific traces where we can actually look at the brain of patients with Alzheimer's disease and see if they have amyloid and tau deposits in the brain. And this is now part of the workup for diagnosing mild cognitive impairment. And we call this MCI due to Alzheimer's disease. We used to think of it kind of as a separate theory, but now we really feel like it's part of Alzheimer's disease, and we call it prodromal Alzheimer's disease, or mild cognitive impairment due to Alzheimer's disease. And this is just to show you the gradual progression of Alzheimer's disease. And as you can see, some patients start gradually, and then you get a gradual decline in memory, whereas the yellow line is normal aging, the brown line is what's typical of the course of Alzheimer's disease, and each phase lasts about 2 to 4 years. So you get the mild phase, the moderate phase, and the severe phase. And this is the course of the illness. And you can think of many famous people with Alzheimer's disease who kind of developed this course, like Ronald Reagan. Later in his presidency, he was starting to use cue cards because he couldn't remember things. But he didn't have Alzheimer's. He probably had MCI, mild cognitive impairment at that time. When he came out of the presidency, he developed moderate disease, and he wrote his farewell letter to the American people. And then eventually he went into the severe phase where he wasn't able to function. But in the mild phase, people function pretty well. In the moderate phase, they start to have functional problems. And in the severe phase, you get total loss of independent function. Can you spot the differences in these two pictures? Anybody?
The window.
How many do you see?
There's three apples in one and two in the other. There's a flower.
Mm-hmm.
A tongue. Open mouth versus closed mouth.
Mhm.
One of the apples
Mhm.
is red.
Great job.
Phone.
Okay, Lisa.
Tail.
Oh, the tail, yeah.
So Alzheimer's disease statistically is one of the top leading causes of death in America in patients over 65 years of age. It's actually the third most costly disease after heart disease and cancer, and it's often neglected as far as federal funding. And Alzheimer's disease is the most common form of dementia. So dementia is an umbrella. And we used to say Aunt Sally became senile, and we put her in the back room, and we thought that was normal part of aging. Senility or dementia is not part of normal aging. It is a medical illness. And dementia is an umbrella term. Alzheimer's is the most common form of dementia, but you can also get Parkinson's dementia, Huntington's disease dementia, depression, dementia due to depression, which can be reversible, dementia due to thyroid or folate deficiency, which is reversible. You can get dementia due to Lewy body disease, which is another form of dementia. So there are many types of dementia. And by the physician taking a careful history, doing an MRI, we can differentiate between these types of dementia. And just remember that when we're talking about dementia, we're mostly talking about Alzheimer's disease, but not entirely. So this is just to show you the forecast for Alzheimer's disease. Currently, 4.5 million Americans suffer from this illness, but by the year 2050, we're going to see that figure quadruple to about 16 million Americans, and that's mainly a function of the aging of the American population. And this is really the plague of our century. We've had polio, we had the plague, we've had malaria, we've had polio, but this is really our typhus. This is our plague in the year 2018, and it's something very serious facing the country because of the aging of the American population. And we still don't have a cure for Alzheimer's disease. Princeton Medical Institute is part of the Global Alzheimer Platform, and we're sites dedicated to finding a cure for Alzheimer's disease. And we hope to have a drug on the market that actually helps Alzheimer's disease by the year 2025. But that means the drug already has to be in clinical development for this to occur. Alzheimer's disease is often missed. People go into their physician and they don't get memory testing. So it's very important to get memory testing on a regular basis. And patients may show very subtle symptoms such as depression, memory problems. Physicians are paid to do screenings, paid by Medicare, to do a screening evaluation once a year. But anybody who wants to come into our office in Princeton can give us a call and come in for a free memory evaluation. They don't have to participate in a study with us. This is available every day of the week, and it's free for anybody who's interested. And so it is a great resource. But it is important once you're over age 65, 70, to get a memory test every year. Alzheimer's disease, how do we diagnose it? Well, physical and neurological exams. So usually the physical exam and neurological exam of a patient with Alzheimer's is absolutely normal. Whereas in a post-stroke patient, you'll find paralysis, you'll find loss of sensation, you might find differences between the right and left side. But in an Alzheimer patient, they're physically robust, neurologically robust, especially in the early phases. A medical history review, look at for history of stroke, history of trauma, mental health assessments, rule out depression, assessment of thinking and functional memory, and cognitive testing. So what we do is we do a mini mental exam, which is usually a test that takes about 30 minutes. And Also, we do a more specific test, like the Montreal Cognitive Assessment Scale, which will help us detect more early disease. If the patient's having a problem with the Montreal Cognitive Assessment Scale, we'll do a more detailed word recall test, such as the fixed and free recall or Buschke selective reminding test. And all this can be done in an hour of screening pretty easily. We do blood tests to rule out thyroid or B12 deficiency, which can cause dementia. And then brain imaging, MRI, PET scanning, may be part of the workup. If somebody is going forward with a clinical study, we will be doing the MRI and the PET scan as well. And this is just to show you, now this is the old-fashioned PET scan. This is just showing functional activity in the brain. In an Alzheimer patient, you can see less functional activity, less reuptake of oxygen in the brain. But now we're doing more specific PET scans, looking at specifically the amyloid using traces. We can actually see how much amyloid there is in the brain. So Alzheimer's disease symptoms usually start in the late 70s, 80s, especially 90s. Onset is insidious. It's gradually progressive over 10 years. So as I talked to you about the course of a typical patient with Alzheimer's before, each phase lasts about 2 to 4 years. 3 phases are basically 10 years. The initial signs are memory loss, problems with executive functioning, and that means like the person who was a great cook is forgetting parts of the recipe. The person who was a great bridge player could beat anybody in the bridge game, can't do that anymore. The accountant who was perfect is not balancing his books. The woman who was doing the checkbook at the home can't do the checkbook anymore. And that's what we call problems with executive functioning. And in order to progress from MCI to Alzheimer's disease, you have to have problems with executive function, not just memory problems. So initially you get the early Alzheimer's disease or MCI without any problems with executive functioning, just difficulty with word recall, memory. Then you get the Alzheimer's disease, which is the moderate form, where you're having some difficulties with executive function. And then you get severe Alzheimer's disease to the point where some patients have to, they become immobile, they become bedridden, they get aspiration pneumonia, and they die. So that's the general progression of a patient, of a typical patient with Alzheimer's disease. What are the risk factors for Alzheimer's? The biggest one is getting old, unfortunately. Hard to prevent. And of course, we're healthier now than we were decades ago. We're living longer, and we have more baby boomers. So that's really, really the major cause of Alzheimer's disease. You can have gene mutations, so some people are born with genetic mutations which may cause Alzheimer's disease. There's some families in Colombia and South America that have a specific mutation that is autosomal dominant. So everybody with the gene will develop Alzheimer's disease, 100% guaranteed. They will develop the Alzheimer's disease if they have the gene. So these are the susceptibility genes, family history. Females have a slightly higher rate of Alzheimer's disease. Lower intelligence, so intelligence may be protective. Lower education. Head trauma may be a big contributing factor, so it's more common in people who've had head trauma, boxers, football players. Elevated cholesterol and blood pressure, insulin resistance. So we sometimes consider insulin very important, actually. And we're trying some insulin therapies now in Alzheimer's disease. But if you can think of it, what's good for the heart is good for the brain. So keeping your blood pressure in control, keeping your sugar in control, keeping your cholesterol and triglycerides in control are all important risk factors and things that you can do to help lower your risk of Alzheimer's disease. So there are two major pathologies of Alzheimer's disease. One is the amyloid theory, which is the predominant theory, been around for a long time. And Dr. Alzheimer, over 100 years ago, described this pathology in the brain of plaques and tangles. The plaques are the amyloid, and the tangles are the tau. And we have still different debates even in meetings in 2018 about between the mouse, so people who believe in amyloid, and the tau, so the people who believe in tau. And more people are agreeing that probably both are important. But there used to be kind of a big schism between the two. And now we're thinking that maybe tau is actually more important overall than amyloid and may trigger the whole cascade. Education, obviously, being educated, keeping your brain active. It's important for active cognitive involvement and leisure activities. So becoming a couch potato is a risk factor. Be active in your community, get involved in activities, interact with people, physical activity and exercise. It has been shown in many studies, the finger study and a study conducted by a friend of mine, Lead Principal in Finland. She did a study over a several year period where patients were assigned diet and exercise, and other patients were just given general medical advice. And the patients who followed the diet and the exercise program did show a lower incidence of developing Alzheimer's disease. And Mia has done a lot of work in this area, and it's continuing to do a lot of work. Alcohol in modest amounts may be preventive. Still a little controversial. People who historically took non-steroidal anti-inflammatory agents actually have a lower risk. But when we try to use these non-steroidal anti-inflammatories and prednisone in people who already developed Alzheimer's disease, all those studies failed. And we did many studies with prednisone, psilocybin, with all these non-steroidal anti-inflammatory drugs, and none of them worked once you developed Alzheimer's disease. Now, stress management may be helpful, so keeping your brain less stressed. Things you can do there, of course, are stress management, exercise, meditation. Go to the next slide. And we've developed as part of the global Alzheimer platform something called the Memory Strings Connection. And if you go to memorystrings.org website, you can find all this information, and it gives you information on the 8 pillars of brain health. Eat well, stay active, sleep well, so getting a good night's sleep is protective. Exercise your brain, connect with friends and family, as I mentioned, relax and reduce stress, control risk factors we talked about, and get involved in research. So we do offer an opportunity at Princeton Medical Institute for patients to be screened and to participate in clinical research studies for Alzheimer's disease and keep your brain healthier longer. And this is just, if you just Google memorystrings.org, there's a wealth of information available there, and there's certain tests that you can take and some brain games that you can take, and it's developed in conjunction with the Cleveland Clinic. So other things you can do is training in memory, learning a new language that can challenge your brain. Pretty good challenge to try to learn new languages, crossword puzzles, reading books, keeping your mind active, Sudoku, crossword puzzles. These are all things that are helpful. Lifestyle changes. So we said what's good for the heart is good for the brain. So eating the Mediterranean diet, which is rich in vitamin E, unsaturated fatty acids, and if you think of what people eat in Italy, the olive oils, the nuts, a lot of fish, vitamin E, these are all things that are actually antioxidant. In India, they eat a lot of anti-inflammatories in their food, the cumin, the turmerics, those are also anti-inflammatory. Supplement with olive oil and nuts associated with improved cognitive functioning. This is one of the meditations that is easy to learn, and basically you can imagine this energy thing coming through your brain. And Dr. Singh in California has actually done some studies using this meditation technique in patients with Alzheimer's disease, and has shown improvement in cognition and also, patients with early phase. It's basically just you sit in a relaxed position, with your legs crossed, preferably on the floor, and you apply about 5 pounds of pressure, and just say sa, ta, na, ma, and you do it for about 11 minutes, 2 minutes aloud, 2 minutes and with a hoarse breath, 4 minutes silent, and 2 minutes aloud. So we also do have medications on the market. I'm sure you've all heard of Namenda and Razidine. These are medications that have been around for a long time. And at Princeton Medical Institute, we did the studies for all these compounds. They do help with memory initially, but they don't prevent progression of the disease. So many of our patients come in on Aricept, and they can stay on Aricept during the study, but Aricept is not going to prevent the disease from progression. Another drug is Namenda, and Namenda is often used in conjunction with Aricept. So we often see patients on Namenda and Aricept in combination. But that's fine. People who are on those medications can still participate in our clinical trials. How many F's here?
Two.
3.
Three.
3.
3.
Are you counting the sentence on top?
Oh.
No, only in the bold.
1, 2.
3, 4, 5.
Actually 6.
Oh my gosh.
Oh wow.
So these are the kind of little exercises you can do to keep your brain active. I don't always do so well at them, but. So clinical trials, of course, offer patients a large variety of options. As part of the global Alzheimer platform, we're doing many clinical studies in Alzheimer's disease. These can be phase 1, where we're taking normal, healthy patients, or patients with very early disease, or patients or using this drug in patients with disease. We're just trying to find a dose range and a safety range. The major studies that are around are phase 2 and phase 3. We're actually taking patient populations, and phase 2 is mostly to try to develop the actual dosages that may work in phase 3 and which are the better tolerated. And phase 3 are the kind of well-known clinical studies that enroll thousands of patients in hundreds of countries around the world, and those are the most common forms of clinical trials. And usually we have a placebo arm, and people say, why do I have to take the risk of being on placebo? But that's really part of the rigorous design of these studies, and it adds scientific integrity to the study to have a placebo arm. So but all our studies are approved by an ethics review board to make sure that patients are protected for their safety. But participating in a clinical trial is one of the safest things you can ever do. I have a colleague, Dr. Joyce Kramer at Yale, who wrote a book on clinical trials, and she says the best medical care you can get in America is through participating in a clinical trial. Why would you participate in a clinical trial? Well, you get all this $1 million workup for free. A PET scan alone costs about $4,000, and that's part of the workup that you get. Access to these latest medications. Well, you can't get these medications except in a clinical trial. There's nothing on the market that can prevent progression of the disease. Everything's free, including the doctors and the medication. So there are not many places you can see a board-certified physician for free and get medication for free. The supervision, the assessments, we provide aftercare, and we do provide stipends and compensation for patients participating in the studies. And as part of the global Alzheimer platform, we have a partnership with Lyft to actually give people a lift to our office if they have trouble getting to our site. So just to wrap up, Mr. Osborne, maybe excuse my brain is full. I hope I've given you some stimulus to think about the problem of Alzheimer's disease, maybe some solutions. The most important message is early screening, and to know about clinical trials and things you can do to prevent Alzheimer's disease. Thanks very much.